In phase 1, the nurse didn't introduce herself. She didn't wash her hands. She didn't ask the patient what his name is and use 2 patient identifiers. She didn't ask for his allergies. She didn't ask him to rate his pain on a scale of 0 to 10 or describe any of the characteristics of the pain. She didn't ask for the patient's birthday. She didn't properly perform a medication reconciliation, and she is not wearing a mask. In phase 2, she didn't take the patient's temperature accurately. She didn't take the patient's pulse. She palpated the patient's abdomen prior to auscultating. She didn't listen to the patient's anterior or posterior lung fields. She didn't listen to the patient's heart at all 4 valves. The patient almost fell out of bed, so the side rail should have been up when she was looking at the patient's back. She didn't get an accurate blood pressure reading, and she did not assess the patient's respirations. For phase 3, the patient's blood pressure, heart rate, and respiratory rate are all priority diagnostics, as well. The patient's high red blood cell count, high white blood cell count, low hematocrit level, and low potassium level are also priority diagnostics in the care of this patient. The patient is most likely experiencing some form of a gastrointestinal or renal problem that's causing his pain in the right lower quadrant. Based off his lab values, one could infer that he is either experiencing a kidney stone or possibly acute appendicitis. In addition to a CT scan, an abdominal ultrasound would be helpful in determining the patient's diagnosis. As well, a urinalysis should be included. In phase 4, the nurse tells the patient that he can't have any medication if he doesn't stay in bed. She doesn't give the patient his call bell, stating she'll come to check on him. She's not wearing a mask again. She made up a temperature for the patient. She doesn't stay with the patient to ensure that he has taken the medication. She doesn't ensure that the right medication is being given to the patient. She doesn't check the dose with the MAR, the medication with the MAR. She doesn't make sure that the medication is going to be administered at the right time. She doesn't check to make sure that she's giving the med through the right route. She doesn't document the medication being administered to the patient. She doesn't check that this medication is being given for the right reason, and she didn't check the patient's allergies prior to administering the medicine. In phase 5, the patient's code status is a DNR. She shouldn't have started CPR. The patient should have had his call bell and could have pressed it when he started to experience respiratory distress. She should have stayed with him after to monitor him for any adverse reactions or checked on him sooner to determine if there were any adverse reactions from the medication. She didn't need to get the crash cart because he was a DNR, and she should have already checked the patient's allergies prior to him going into respiratory arrest.